To rehab someone, it is not a rocket science. Only and only you need to understand the anatomy better. That's it. And the work will be done. Okay. It is that simple. All right. So we will go there what step by step. So don't really worry about anything. Just be very, very relaxed. You don't need to sit tense that, okay, what is going to come and how will I learn? And this, be very relaxed, just completely relaxed, and everything will go in a very smoother way. Okay. And you will just practice it also with me later, and you will get to know everything very easily. So don't worry about anything. So if you will see all these 7 vertebrae here, these are very tiny. Look at them, very tiny. And look at their intervertebral disc, very tiny, not thick. See, comparatively, look at the lumbar. Can you see how thick they are and how big the bones are in the lumbar? Right? So lumbar bones are big, and thus their discs are also very big. But if you'll see here, discs are very narrow and the vertebrae are very small. And we are going to discuss that how people get mostly that lower back pain. All right. So we will begin again with that systematic way, slowly and gradually. I will make sure that there should not be any question left, which will be there in your mind after, finishing the topic, because I make sure every time that I proactively give all the answers so that there is nothing remain. But still, if you will be having, you feel free to, ask. All right. And we will see that what are the reasons of lower back pain, which is basically, if you will see, 90% of the population in the world are going through lower back pain, some or the other kind, all right. But if you will see, mostly in those 90%, 99% cases are starting from same cause, right, nowadays, right? Until unless it is like a trauma accident again, if someone have already met with an accident, or a severe injury to the lower back directly because of fall or something, those are the different cases, the fractures and other things, right? Apart from that, mostly if you will see, everything is starting from the same root cause, mostly. Cool. So we will see all those things now. This is why whenever people have spinal injuries, it is very, very tough for them to live now, right? And spinal injuries happens, again, it can happen over a period of time, or it can happen directly with trauma. So we will discuss everything. In between any two vertebrae, there is a disc, intervertebral disc we call, right? Intervertebral disc, whose function is what? Just to provide cushioning. That's it. Just to provide cushioning, keep these two vertebrae away from each other. So the idea behind it, why we did it, so that we can understand that why many people around the world are going through lower back injuries. Okay? Because it starts from our movement. It starts the way we move, the way most of the time sprain on the ligaments. So a back spasm is an involuntary contraction or tensioning of a muscle in the lower back. These are the big vertebrae and big thick disc in between them, right? That means have enough space for this nerve root to come out, right? But at the same time, when sciatica related issues will start to happen, a lot of irritation, nerve irritation, radiculopathy will start to happen, a lot of pain will start to happen, unable to sit, unable to walk, unable to do anything will start to happen. Right? Mostly it is not the whole muscle which is troubling you. Mostly it is like few points in the muscles. So you have to find out those points, see if it is the right opportunity to just discuss a little bit quickly with you the MRI. Just say this is a boy who is young boy around 26, 27 years, right? So this is a boy who got hurt in the gym, all right, while doing any activity. So you can get hurt anywhere, isn't it? It is not only gym, it is maybe at home, like we discussed in the back workshop already, is it, right? So we have already discussed these things there in back workshop, that people can get hurt anywhere, right? Whenever your spine is not doing right function, you can get hurt. So this is one of the case. So this is the spinal cord inside, this one, the whitish one, can you see? And these are the disc, and this is the vertebra. Now look at this L4 and L5 in between. What is happening to the spinal cord? This is the spinal cord going on, And this, sometimes it is more of a biomechanical disadvantage to the knee. Sometimes it is more because of your wrong movements patterns. Sometimes because of unawareness. Sometimes because of lack of movement. There are many, many reasons for knee joint. Knee joint really doesn't require any reason to get pain. It is so poor joint. Biomechanically, it is at certain area that it is always in a trouble. All right. So that's what we will. This is the knee joint, if you will see here, right? So combination of what? Femur, this is the thigh bone. Tibia, this is the lower leg bone. And patella, that's it. These three, where they're coming and joining together, we call it a knee. If I will move this away and this away, knee disappears, right? No more knee. No more knee for you, right? So combination of these we call knee joint. All right? Cool. So that you understand better how to do it. So anatomically we learn like this, isn't it? Anatomically. And what is anatomy? Anatomy is dissection. Anatomy is dividing, isolating the parts. So the more, like nowadays, if you would have seen, most of the joint related issues are happening in the people who are more highly active in their lifestyle. Like they want to do running, they want to do swimming, they want to do everything in their life, CrossFit and I don't know what, right? They want to participate chronic use or overuse conditions. So like osteoarthritis can happen with chronic use and overuse condition. Chondromalacia, which is also called patellofemoral pain syndrome, which can happen, which we also know as a runner's knee most of the time. If you would have heard of this term runner's knee, most of the time we heard that, okay, we have got runner's knee because of running. It is not only because of running we have a runner's knee. It is like that. It pains while running, while climbing stairs, while walking down the stairs, while squatting, while lunging. So any pain when you have while all these activities, we call it a runner's knee, basically, which is chondromalacia or patellofemoral pain syndrome. Then IT band syndrome. Many people get IT band syndrome. We have named it. We have just named it like that. So it is on the lateral side of the thigh, lateral side of the knee. We get the IT band syndrome. Okay, normally pain there. Tendinitis, as the name suggests, tendonitis. That means inflammation of the tendon. Whenever the tendon is getting inflamed, it can be your quadricep tendon, it can be your patellofemoral tendon, anything. Meniscal tear can be acute, meniscal tear can be chronic. That means with your wrong movement, slowly and gradually, you are getting the tear on the meniscus, right? And bursitis. So in that case, many people leave the rehabilitation process in between only. And then that can also lead to knee injuries like this Q angle. And whenever the angle is like this, the patella is going inside, you're getting compression here and you're getting lengthening on this side. Also, because of pronation of the foot, it can lead to this case. Or maybe you can say, because of this, you can lead to pronated foot. Otherwise, you're going to get terminator knees if you really love it, right? So you can cover the full quadricep muscle in the front in three parts. You need to see that what is the requirement of that person, what kind of pain person is going through with some testing assessment or just talking, right? So whenever you get these kind of referred pain, whenever you get these kind of thing, so you can easily see that, okay, these vertebrae are giving me some trouble. Okay, because of this movement, I'm getting these troubles. Okay, now we will see the shoulder stability and strengthening. All right, the exercises which are very important because it is not only about the stretch and then don't do anything. Now we have to work on the stability part and the strengthening part of the muscles around the shoulders. So we will go to the serratus activation first. So in serratus activation, we have all this, and then definitely don't neglect these. And what are those? These are the rotator cuff muscles. Okay, we cannot neglect. If you will use heavy resistance band, then other muscles have to come in between to work. So you will not allow other muscles to come, and that's why I'm saying use the light resistance, which gives you little upright spine like this, and then you can just sit, and then you can do meditation, you can do your computer work. All right, guys. So how was your overall experience? 4 workshops you have done.
Sir, I wanted to say really thank you because I've learned a lot about the anatomy, reasons, and then cure also. I I had no idea about many of these things, but I've learned a lot.
So, sir, the whole idea how you taught us about rolling, then stretching and all these things na sir, we, at least I don't do it, so this is something nice that I have learned, and in very detail sir, the way, and you have explained us the anatomy part, so that when we are actually doing it we can connect, rather than just doing it without any awareness. We can do mindfully, I will put it that way. And nothing, sir. I think it was fabulous, sir. The way you teach, the depth you teach in, and all the details, sir. I loved it, and I want to do as many workshop as you have, as whenever upcoming. So do keep us posted
Sir,
on.
I am the already a big fan of you.
I
So
don't.
I just want to say thank you so much for this class and let me join this class because it's different level of understanding from the first course that I have learned. And also I'm so happy because I can reach my hand today. Thank you so much. It's really helpful because it gave me more clearer understanding everything I have learned in previously. It's like a really good revision for me at a deeper level. Thank you so much.
You're highly welcome, Emily. Very welcome. Yes, so every course, that's why it is different. We cannot say that if you have a headache medicine and it will cure your other part of the body. No, it won't. So similarly, when you do certain course, it is designed particularly for certain reasons, right? And that's why whenever you do different things, you find different things there, even if you're working for the same body, right? So people who have done 200 hours with me, the 200 hours is more about holistic course of yoga teacher training rather than making you injury specialist or something. It is more like holistic approach on teacher training. So we just focus there. But here, this is now after that specialized courses. So where you learn something different than that. So similarly, all the, like if you'll come into prop work now, like you're coming already, Emily, you will see that there will be many prop work now, not only this much whatever we have done here, there will be many